Welcome to the Better Together webinar, Healthcare Communication Lessons Learned from COVID-19, presented by the University of Oregon's School of Journalism and Communication in Portland. SOJC in Portland offers immersive graduate programs in strategic communication and multimedia journalism to advance your career in strategic and visual storytelling to stand out in these evolving fields. Our very own associate professor and director of the Strategic Communication Master's Program, Donna Davis, will be moderating this excellent conversation with Orest Holubec and Gail Baker. I'll turn it over to Donna.
I want to start with a really quick question, a poll, which Jenny is going to help us with. What we want to start with is get a little bit of insight from you as you think about those early days of the pandemic. Where did you get your primary information about COVID? And because it is multiple choice, you can click all of the above. You can click the ones, and feel free also in the chat to say maybe which one was your primary source. We didn't actually independently list Anthony Fauci, although maybe we could have. So as you guys are responding to the poll, and welcome to those of you who are joining us, continuing to join us. What we want to do is start with day one, case one. Of course, Seattle had the esteemed pleasure of being the first site of the first case announced in the US. Okay, we have people who, yay, professional news sources and the CDC and state and local national government being the top sources. So I love this audience already because we'll talk about, as we think about day one, case one, there are so many things that we generally know what happened, what is COVID? What is PPE? Misinformation and disinformation, vaccines. We're going to talk about vaccines a little bit later, but there's been such a wild roller coaster ride of big issues and topics that have emerged in the course of this as communicators that you have had to navigate. So I want to start with Orest on where do we even begin? Let's talk about what you were dealing with and how did you respond?
Thank you, and thanks for having me here today. And as we talked about before this, the hard part is what are we not going to talk about, because this could easily be an hours-long webinar. And also I just want to say I'm speaking on behalf of an incredible communication team of about 100 people who sit in our 7-state footprint. So thank you to all of you. Some of them might be on the webinar today. But so on January 20th, the first known case of COVID in the US arrived at Providence Regional Medical Center in Everett, obviously here in Washington. Shortly thereafter, the hospitals across the country became overwhelmed with patients and cases, and that led to an unprecedented demand on PPE, when we no longer have to explain what PPE is to people, as you mentioned, Donna. And then we also had to, because of that, for many reasons, the overflow and lack of PPE, elective or what we call non-emergent surgeries were canceled. So we were managing COVID cases in nearly all of our hospitals. The information about the virus changed and the disease changed daily, and that put a ton of stress on our clinical leaders, our admin leaders, and obviously our communication team and leaders. We were dealing with misinformation that came from various sources, and this added to the stress. And the communication leaders became key parts of the care team. We've always called all of our employees across Providence, we have about 120,000 caregivers, because no matter what role you play, you're part of the care team. We've felt that more acutely during this crisis than ever before. So communication leaders were definitely part of that care team. We worked to dispel myths and disinformation that was out there. And we always tried to position Providence as a credible and authoritative source of information, but also we tried to do that with great humility, because there was a lot that we didn't know, and we were careful to talk about what we did know and not make up things about what we didn't know, although the temptation to jump in front of science was there at times. We plugged our communication leaders into all of our emergency and incident command centers. We had daily communication stand-ups that topped 60, 70 people at times, where we shared best practices across the footprint. We say providentially when things happen for a reason that we're not aware of, but about 2 or 3 months before the pandemic, we went all in on the cloud with Microsoft and installed Teams, which is a tool we hadn't had before. I don't know how we would have done it without it, because everybody, 90,000 caregivers had Teams set up, and we were automatically connected in ways we haven't been before. We also made investments in digital that I can talk about later, and did a ton of work around advocacy with government to help accelerate telehealth, to ensure that we get funding that was lacking due to the canceled surgeries. In short, by the end of 2020, our clinicians cared for and treated nearly 50,000 patients, and to date, we've administered more than 600,000 doses of vaccine that I know we'll talk about later. So before I kick it over to Gail too, I just want to say one of the things that made us most successful is that we had a University of Oregon graduate who I'm going to embarrass right now, Adrienne Webb, who served as our national PIO and ran communication for COVID for Providence, and she did an incredible job and helped me prepare for this. And I just want you read you the PS she sent. She said, "Orest, if you can please wear green and yellow on camera tomorrow, that would be great. Kelly green's hard to find, so face paint might be your only option on short notice." So thank you, Adrienne.
Oh, thank you, Adrienne. Indeed. Yeah, Gail.
Well, I wish I would have had the advice. I would have worn green. I wasn't even thinking. Well, first, I want to say what a privilege it is to be here, and thanks for inviting me, but more so what a privilege it is to be here with Orest, because I have so much admiration for those of you who are on the front lines at the beginning and even today. And what I can say for Cambia, we are a support to the providers who are providing and the doctors and the nurses that are providing the care. So great privilege, and you are all heroes, all 120,000 of you. So the first, we had been, Cambia is the corporate parent for 6 health insurance companies, including 4 Blue Cross Blue Shield companies, just to give you a perspective of what we do. And we, from a communication standpoint, are always looking for the issues that are coming. And we had raised this pandemic thing in Wuhan for our teams, our incident command center to be watching. And so we were thinking about it, communicating internally to make sure we were prepared. And when it hit, and as Orest's team were taking care of patients, we were trying to ensure we're communicating with our members and our customers appropriately. One of the things we did very quickly was have some guiding principles to our pandemic response as a company. And our guiding principles were really, first and foremost, how do we ease access to care for our members? And so an example of that would be, I remember that first weekend where people were starting to panic. I think of the first cases in Seattle and San Jose, and trying, that when people go to grocery stores and getting toilet paper and running out of toilet paper, we decided to allow people to get their prescriptions refilled before it was time, right? So if someone to fill their prescription, they could, so you can have your prescriptions. We helped with the advocacy around telehealth to make sure people had access. We expanded the type of telehealth we were offering. We looked to advocate for easing some of the rules around telehealth, so we knew that so the providers could connect, our members could connect with their doctors. So those are the types of things we've done throughout the past 14 months, because our number one principle is to ease access to members. We also did focused on the well-being for all of our employees. We have 5,000 employees and 99% of them overnight work from home and have worked from home for 16 months. So it was credible. We had the Teams issue too. We all hated Teams until the pandemic hit and we were working from home, and now we all love Teams. It has enabled us to be, even though we're two-dimensional, we can see each other and engage with each other. And then we've done an incredible amount in our communities around health disparity, around, again, supporting those with the most need. And so I think over the course of 2020, we donated between the foundation and the company $20 million across our 4 states to provide support. So those are some of the things we did at the beginning, because they were all kind of tied back to the members, employees, and communities aspect of how we were going to respond.
Thank you, Gail. And I should add, Gail was actually teaching a management class in our program when this all started. And I'd come into her classroom on Wednesday nights and go, how are you? You know, how is it you're even still here? Thank you so much.
Well, it was a great topic for the students. We had the 2 weeks that we were in person when this was all happening. It was a really great case study for leading communications during a crisis.
Well, and that leads me to our second question, and you tapped on it already. Not yet, Jenny. But the second question being that we are, as you talk about audiences, and this is one of the things Orest and I talked about early as we were navigating what we would be doing here today, is that, you know, you said you were ready for this. You ran it like a campaign. It's a classic campaign. And in a campaign, you've got different audiences. So I'd like to start with your external audiences and communicating with them. And because there's lots of different ways you think about those external audiences and the way you talk to them. I'd like Orest to start. And I also want to address that question of the equity issue as we think about external audiences.
Thank you. Yeah, I'll say, you know, first we recognized as a communication team that we had an opportunity here, given that we had the first case in the country, and we didn't want to take that for granted and wanted to be, again, that credible and authoritative voice during the pandemic, not knowing how it would unfold, obviously. We had willing and credible clinicians. Our footprint, Providence is essentially a microcosm of the country. We have rural healthcare, we have large urban centers, and so we knew we had a story to tell that could translate nationally. Around a few months into it, Edelman came out with their trust barometer, and it showed that people trusted their health provider. So we didn't want to take that for granted either. And we did take a campaign mentality on. So we always thought about, what's the call to action? So if we have a clinician on CNN, we know that Chris Como may want to talk about testing, but if we need to talk about PPE, we found a way to talk about PPE. After elective surgeries, after we were allowed to do them again, people were hesitant to do them. So we had to ensure that people knew it was safe to come to get your surgeries. And we used those opportunities to get the message out on that. Vaccinations is the one that we're obviously working on day and night today to get as many people vaccinated as possible. On health equity, Providence was founded by Catholic sisters, by nuns that came here from Montreal, from France. I mean, there's a tapestry of history here that about 170 years ago they came in to take care of in the West of orphans during the gold rush, and so taking care of the most vulnerable has been in our DNA. It's still in our mission statement. 170 years later, we have the words steadfast. We're steadfast in our commitment to serve all, especially the poor and vulnerable. We know minority populations are overrepresented in low-income neighborhoods. They're not always the most poor, but they're much more vulnerable than the white population because of structural racism, ongoing discrimination. and things obviously leading to barriers and access to care. After George Floyd was murdered, like many others, we took a long look in the mirror. And our CEO, Rod Hochman, said we need to do better, not just as Providence, but as healthcare to end inequities in healthcare. So we stood up a Health Equity Council. We put a small amount of money for starters, but $50 million behind it. But most importantly, we put out a call to that council for measurable results. And we took that mentality into our approach to vaccinations. So we're working as hard as we can to communicate with vaccine hesitant communities in their voice, with trusted influencers and trusted leaders in communities. We know that the doctors in white lab coats aren't always the most credible for all audiences, to Donna's points on knowing your audience. So we're working with everybody that we can to really, the most effective stories have been the ones where our spokespeople have been vaccine hesitant and have gotten past that and can explain to their communities how and why they did that and why it's important to be vaccinated. I had a call this morning about amazing work we're doing in Sonoma with farm workers, which are predominantly Hispanic, and we have mobile vans, and I know Gail will talk about that too, and outreach programs where we go out to the under bridges and homeless encampments before the van comes and say, hey, here's what's happening next week, spread the word, and that's been really successful. We work with public health on the mass vaccination sites, obviously do a lot of government advocacy for it as well. So again, we try to approach this with the credibility and humility, knowing that we're not always the best spokespeople on the issue.
Thank you very much, Orest. And Gail, I know that you have put a lot of effort into this. I mean, you're dealing with external audiences in general, and then you're dealing with external audiences very specifically.
Yeah, I'll start broad and then go to the health equity issue. And yeah, I think when we look at kind of audiences, we prioritized our members and communicating with them and looking for unique ways to ensure we were out there. We also know our doctors and our nurses are the most credible. So we had some unique sponsorships that we had weekly in each of our markets, doctors on news programs talking about various things, where to get the best information, how to stay safe, how to wear a mask. I mean, behavioral health, how to get access to behavioral health, just generally being out there as a voice. And it was one way to get to our members. We also have, as a health insurer, our customers, our employers, large employers, small employers, medium employers who have a lot of employees. We did a lot of work with them. We held 87 webinars over the course of the first couple of months, just to ensure that they had the most up-to-date information. We again deployed our doctors to be out and our nurses to be out talking to them. So did a lot of very specific outreach to our very specific stakeholder groups. One that we didn't talk about, but was on our speed dial, was regulators and policymakers, because we're always looking to advocate for things that we're going to get care to members more quickly. And I think, along with, I'm sure, Orest, your team was doing the same. And then we work really closely with community members, and I'll pivot now to the health equity aspect, because, prior to the George Floyd murder, we were seeing the health equity issues with more people of color and being impacted by COVID and more seriously. And some of our community investments were going toward that. But after, just like Providence, after the George Floyd murder, there was a lot of introspection of what can we do and what can we do better. And when it came to the vaccines, that's where we really felt like we could push in and lean into that and play bigger with our members specifically. So, and over the course of the since the vaccines, knowing that the vaccines were going to be available in December. We've worked very closely with our community members. We've into community health centers, funding community health centers, working with community groups like MTI or Medical Teams International. We're funding a van that's going into low-income neighborhoods. So people who won't generally have easy access will have the vaccine going to them. We are funding Lyft in Utah to give free rides to and from the vaccine. And I think one of the things that is most heartwarming is our care managers and our customer service. We're looking, we use a lot of data, and we know where people are in neighborhoods that have less access. We're tracking the neighborhoods that have less access, and we're doing outbound calling and getting people connected to vaccines. Our customer service teams called everybody in the high risk group of age 65 and over, and if they were having trouble getting through the signing in online, our customer service folks had the steps and walked them through and helped them sign up for their vaccine. We're calling every member to say, you're eligible for a vaccine. Have you got a vaccine? If you don't have a ride, we'll give you a coupon, or we'll find some way to get you to the vaccine. So there's lots of different efforts in all of our communities of ensuring that our members are are aware and are getting access, whether it be one-on-one communications, broad communications, or funding our community partners. And like Orest, you said, we know that maybe we're not the most trusted. So how do we go about finding those who are trusted in the communities of color? And we've done, again, lots of outreach. We have our, we did a big webinar with our medical directors, talking to community partners, asking what they needed, and then providing that support.
Yeah, we coined the term, like we want to ensure that we're not vax-splaining, because people understand
Right.
vaccines are important, but that doesn't mean that they're going to get over the hesitancy.
Yeah. So
and you mentioned government affairs. Just one more duck shout out to Ali Santori, who's our chief advocacy officer, and did an amazing. She and her team did amazing work throughout to ensure we can do telehealth more effectively, have funding available for mental health programs, and so lots of ducks here at Providence.
Yeah. So just talking about data, we saw, by advocating for telehealth, allowing more types of telehealth, we watched the data go from very little use of telehealth to like 80% of our claims that come in being telehealth. That's eased off when it's in-office visits, but when it's behavioral health, and we really leaned into the behavioral health space, we saw it go for like 75% now is, and I'm going to get the numbers wrong because I don't have the data in front of me, but close to 75% of all behavioral health are telehealth, and that did not go back. And some fundamental things that are changing in the healthcare space that aren't going to go back. Behavioral health is going to be accessed through telehealth. It's a great channel to connect people with their provider, and so that's awesome to see that more people are getting access to behavioral health. We also did a lot to expand our members' access by bringing in some national behavioral health providers. So because we knew that people weren't getting the behavioral health that they needed.
Yeah, it's amazing. And similarly, our numbers are very similar. We had a lot of the services available before the pandemic. And when we ask patients what their preference is, they say they prefer to use telehealth, but they just never did. And that's inertia. And, it took the pandemic to create that behavior change, but we went from 50 visits a day to about 14,000, and seen that level off a little bit. But we want to encourage folks because one, it's more convenient for them, it's lower cost for everybody involved, and so we'll keep working on that with you and others to keep it going.
Well, and we'll loop back to a little bit more about technology, specifically communication technology in a minute. But before we leave our audiences area, I'd like to also talk about internal audiences, because certainly what we saw on the news every day, and then it went into advertising, you know, and all of the messages we were seeing were about those first line workers with the permanent mask on their face from wearing PPE for so many days and so many hours. What about your internal audiences and what you had to do to communicate with them? And Orest, would you start us there as well?
Sure. So first I'll start with, we recognized right away burnout is it's a huge issue in healthcare. You know, even before the pandemic, it was a huge issue, but it was getting worse, and when we obviously knew why. So we stood up wraparound services for support services for caregivers, including free mental health and free well-being resources, emergency time off, and we had backup childcare resources. But we also knew that you know, the communication teams don't always like to admit this, but not everybody reads our emails. So we knew we had to find new ways to reach our 120,000 caregivers, and so we used social media. We targeted our folks in LinkedIn, Facebook, Twitter, and we were able to direct them to services, including a virtual stress meter that our digital team built, and that gave our caregivers a chance to determine on a day-to-day basis their level of stress, and then offered corresponding free services that they can, resources they can avail themselves of to help. So and we did, I can talk about this for an hour, but the other thing that we had going for us, and this is, I'll get a little geeky for the communication folks here, but we have a Comtech platform called, and we use Social Chorus. There's a few vendors who do this, but we can communicate to all of our caregivers through a single publishing platform, and then we can measure who's engaging with our content. So, and we can do this in a lot of different ways, but the important part too is we can run campaigns on it. So we can pester people if we really need them to know something or have some information. But we also worked hard to make our content compelling, so that, you know, we treat our caregivers like we do external audiences, and know that we're not always the most credible source of information for them. So that was another blessing, that we had that platform in place, and we didn't have it fully implemented in the beginning, but by the end we did. Big learning for us, and not learning because I guess we knew this, but it's always a great reminder, is that the central authority isn't always the best for information. So in a pandemic, you do want to ensure that we're consistent, but all the jurisdictions that we're in, public health had different approaches to stuff. Like, some things were relevant in Portland that weren't in West Texas, that weren't in Anchorage, but we knew would be later. So we had to do a very local communication strategy. So we started with a central, we had one communication go out to all caregivers, and that was confusing. You know, we did our best, but it was confusing to folks and not always relevant to people. So we were able over time to have a very local strategy with central authoritative information, obviously, that we knew we could share everywhere when and how appropriate.
Wonderful, thank you.
Yeah.
Well, yeah, and I would say we had it a lot easier than you did, Orest. We have 5,000 employees, and most of them are sitting next to a computer all day, talking to members. So we had it a little easier. Thank God for Teams. We had never done a live team meeting before the pandemic, but the week after we all went home, we started doing bi-weekly all-employee meetings, just to give people updates, let them know, and we would have 4,000 people on the calls, and our CEO would engage. We'd have our chief medical officer on, sharing the most up to minute information on COVID, so we could answer questions. And so it was just it became an incredible community. And when you were home and kind of feeling sequestered, having those bi-weekly meetings, which went to once a month after a while, which is incredible. And yes, we did a whole bunch of other things, but we didn't have to use social media to target our employees because they were right there. And one of the things that I think is just amazing over the course of the past 14 months, we've done a employee engagement survey of our employees, and that's the highest numbers we've ever had. And our communication survey of satisfaction and engagement with our communications is as high as it's ever been. And it's just because we just doubled down on engaging with our employees, engaging with managers to engage with employees, lots of support and flexibility for employees because they were on their computers answering customer calls where their 2-year-old might be sitting right next to them, right? And so just a lot of flexibility and support. So coming through the pandemic, the technology has allowed us sometimes to be even closer than we were before. But yeah, it's been a journey with the technology and the glitches in the technology, but it's been really helpful.
That's amazing that you get.
Frank is loving how much we're talking about Teams.
That's right. With 4,000 in a meeting, that's incredible. That's awesome that you have engagement.
Well, and that leads us beautifully right into this whole role of, we've talked about internal and external audiences, and I hear in all of these conversations, this conversation about technology and communication technology. We've had to deal with it in higher education. Everybody's had to deal with it in no industry hasn't been touched by the need to deal with technology moving forward and finding those silver linings and success stories. It's like, what can we capture from this moment to improve moving forward, even if and when we're back into more in-person communication? Talk a little bit about communication technology in reaching, we've talked about internal and external audiences, but you also had media relations. You also had, there's so many layers of communication that you guys deal with. What did you find? How did you know your communication was working? And what was the role of communication technology in all of that? And that's, I'm gonna let Gail start this and we'll set up with Orest.
Well, I'll start with, how do we know that our communication is working? Because I think, there's one of the things, and I'm sure, Orest, you had even more than this. 2020 saw us have 2.5 times in the engagement with media than we'd had in the past, right? Just constant. And tracking all of the things that we've always tracked. But I think ultimately, how do we know that we were successful? Our net promoter score for our members went up 14 points over the last year. And that was when we were communicating. We were sending newsletters, our email, we were sending texts with ones that we had. We were constantly updating our blogs and our websites and talking to them through the media, talking with them through the media. So that to me is the ultimate test. Yes, you can watch engagement scores and social media engagement scores, but the fact that our members felt more favorable and more satisfaction and a higher level of credibility with our members was great. And I think ultimately is the same with employees, right? The thing that I think about technology is it has allowed us to see each other during these engagements, and that's amazing. And so our employee, I think I said before, our employee engagement was as high as it's ever been. Our satisfaction, our engagement with our communications was as high internally as it's ever been. So I think to me, that's the ultimate success.
Awesome, thank you. And Orest.
Yeah, so number of different ways to measure. One on social chorus, we'd know, who's interacting with our content and where, and over time, we'll be able to go back and analyze that. So in terms of things like caregiver vaccinations, it'd be interesting to see if there are places where fewer caregivers are vaccinated, chose to be vaccinated. Did that have anything to do with lower interaction or engagement with communication? So again, that could be interesting. I don't know if that'd be causality, but that's the kind of things we can look at. We do a caregiver experience survey every year. And so, I think out of the 120,000, 90,000 people respond to it. And we fought a little bit, but there was a question inserted into this year's survey, which was something to the effect of, or maybe exactly, Providence has done an excellent job communicating during the pandemic. And I didn't like the excellent word. It's a high bar. I mean, it's a yay or nay. And I think it was a 5, a scale, but I think we landed about 75% on that, and really obviously proud of the team. And and looking back, maybe we shouldn't have fought it as much, but anyway, we also measure, we have an incredible social media team and leader. There's a lot of great ways to measure share of voice and conversation and engagement, and who's sharing what, and obviously, tracking comments. And on earned media, we measure our share of voice vis-a-vis our peers, just to ensure that we're in the conversations we want to be in. And we did well in that for a number of reasons. And I mentioned at first, we don't take for granted that, we got the first case and you automatically get some attention when that happens. And then in internal comms, again, we have social chorus as a measure. The other measure I have is more anecdotal, and our team is invited to all the tables. So when there are meetings on important strategic issues, new strategic councils are stood up, the communication team is leaned on and relied on. And to me, that's one of the most important measures. Or do people want us to play with them or not? And today they do. So
Yeah,
keep that going.
That's a really great point. We did a business partner satisfaction survey, and we got a 98% approval rating. So, and when you're invited to be on the health equity task force, and you're invited to be on the vaccine leadership task force, and invited to be part of the national Tiger team on insurance, the health insurers to help with health equity, that you've got an opportunity to influence from a communications perspective.
And you just sent a new benchmark for our team. Thank you, 98%. We can get there.
You can.
Well, and that's
Congratulations, Gail. That's awesome.
Mm-hmm.
And I think we could have probably spent the full hour on any one of these chunks of conversation. And one of the things that you tapped on also, both of you, was this issue of trust. So our second poll, what I want to ask our audience is, now that it's more than a year since the first case was announced in Seattle, Washington, well, the question that we have for you is, who do you now trust most in the information about your health, including vaccinations? And again, that could have been, choose as many of these as you want. And feel free to also throw in comments in the chat. But vaccine hesitancy is such a big issue. And before I moved to Oregon, I came from the South, and where vaccine hesitancy, I think, is even bigger, and certain populations where vaccine hesitancy is bigger. And there are the news sources that try to discredit. We've got Ellen Peters on the call, who is whose book Numeracy in the Wild talks about how we don't understand numbers, and how social media has manipulated these numbers and fostered this sense of mistrust and distrust. So, and I do look forward to reading Hannah's conversation in the chat. But so poll, do we have answers from our poll? Okay, again, oh, wonderful. So you trust the CDC, and news. And okay, so that's interesting.
I'm looking at that healthcare provider number that went up over the years, so that's heartening.
There you go. As we think about trust and the future of trust, and especially when we're talking about getting your information through technology, which has also been at kind of the center of a lot of trust conversations. So I do want to open up the conversation for any questions that we might have from our audience. And whatever Fauci says, I do love that. We even now have the Fauci ouchie. And yet I refuse to look at Twitter, where there are people who abuse that man every day. And the fact that he has death threats, it's like, what is this? How do we deal with that as healthcare providers? And where are those questions? Questions from the audience. And thoughts from Gail and Orest on that trust issue.
Well, clearly I expected the providers to have a high trust. And we know that from all of our research that for us, it's our care managers, it's our doctors. It's why we've been doing so much outreach, one-on-one outreach during this time and getting people signed up for vaccinations. We're making these phone calls, and I love this. It came in through Twitter last week. Is some gentleman said, "Oh my God, Regents called me to ask me if I had a vaccine and if they could sign me up, and I'm already vaccinated, but isn't that awesome, right?" And so those are the types of interactions, those one-on-one interactions when we're putting our caregivers out there, that you're really building trust with your members and with your community, and hopefully by working through the community health organizations, working through the organizations that support and reach out to people of color and to people who may be underprivileged, that's where we're hoping to build the trust and increase those vaccinations.
And that's certainly been covered in the news an awful lot.
Mm-hmm.
In terms of, you look at the folks who've been least vaccinated, and how do you reach them, and how do you reach them in a way that they trust you? And I was able to scan Hannah's comment, which was speaking with a homeless man who was concerned about her because he knew that she had gotten her first shot, and because he had bought into the conspiracy theories of vaccines. And how do you get people past conspiracy theory when they are so sticky? And it doesn't take an uneducated person to buy into that, as we have certainly seen in the last year. I mean, Orest, do you have how you have dealt with those, or do you simply not deal with them and stay focused on message?
Well, we try to get out to everybody, but the people who are willing to listen are usually the best audience. And again, using trusted spokespeople who can genuinely speak about why they're hesitant, and the hesitancy is legitimate in a lot of cases. So talking through that, notwithstanding conspiracy theories, I think that's a loud but small minority. But so that's the key, is to just continue to have that conversation. Like Hannah put this in the chat for the panelists too, but that's obviously a friend who's homeless but trusts Hannah, and that
Right.
And that's really important work. We're seeing, and everybody sees this in the news, but the vaccination rates there's a downtick. Part of the increased hesitancies, the J&J pause, and so we have to double down on our efforts to ensure that people know that they're safe and available, and help them work through it. With that downtick, we're seeing an uptick in COVID cases, and so that's concerning.
Yeah, one thing I will mention, I did mention that Cambia is part of the White House's task force of insurers who are working on the hesitancy issue. And we have our lovely Tanya Adams here at Cambia, who is leads our customer experience effort. And she's an African-American woman from the South. And she is insistent that we just need to get out to the leaders of the churches and it's been an incredible effort. If you have someone you trust in your church, in your community, stand up and get the vaccine. And there's just great stories about how that is actually working in some of those communities that have been more hesitant. So again, getting people trust. They trust their pastor, right? They may trust their neighbor. They trust, I don't know, where they trust, right? So that's really what's really important at this right now.
And Regina put in thank you for the link on the media, did an excellent segment on how to interpret the confusing and alarmist news like from J&J. And certainly that, I mean, there's been some really interesting news around that in the past week, which I'm sure is right up Ellen's path as well, is that when you think about it was 6 and 7 out of more than 7 million, you know, that the chances of dying from any other number of things that are probably already in your medicine cabinet, or the things that we do every day that have a higher fatality rate than 1 in a million, that people don't even think twice about. And yet, again, these are news notices that are sticky and go viral and then create this problem. Jenny actually wrote a paper about the ethics of communicating to vulnerable populations about vaccines. And we have another student who's doing a capstone project on reaching the Latinx community about vaccine messaging and vaccine hesitancy. So it's a really tricky issue that a lot of people are working on. And here you are doing it while we're figuring it out. What would you say has been the biggest, having to do it while it's being figured out and then going, wait, we need to do it differently?
That happens on a daily basis.
I bet.
And that's why, you know, that humility piece is so important. There's not knowing what you know and knowing what you don't know, and not being afraid to acknowledge that as a, you know, a health provider that's trusted by folks. But if you don't mind, I'll throw a question at you, Donna.
Okay.
So by fall, we expect that these at least a few of the vaccines will be fully authorized. We're obviously under emergency use right now, and the University of California system announced that they're going to require vaccinations of all staff and students, which is upwards of 1 million people after that happens. University of Oregon thinking about something like that too? And you can't ask me because I asked you first.
Well, and we do have some leaders on this call that might know more information than I do about that. I haven't seen any notices that have gone to the general population from Oregon in regard to vaccine requirement. I mean, already there's a vaccine requirement for students, as an example. They have to have that, proof of vaccines before they can register for classes from the traditional vaccines. So whether or not they add this vaccine to that list of required vaccines, I am not certain at all. And Regina says no announcement as in effect as of right now. And I see the list is growing every day of universities that are looking at that. And then of course, then you have those people who say, but what about my independent freedom of decision? And what if I don't want it? Or what if I'm allergic to, or. And again, the university systems usually already have in place those that ability to opt out, you know, that if you've got religious or medical reasons not to take a vaccine, just provide that documentation and you can register.
Yeah, I was surprised by the announcement. It's a really tough call for a lot of the reasons that you articulated. And for us, you know, if we decided to do that right now, we wouldn't have the workforce to take care of our patients, until we get to close to 100% or whatever it is. So
Right.
a lot to think about in the coming months for sure.
And we're even thinking about that in terms of, how do we expect, what do we expect of, and I know that lots of organizations are grappling with this too, in person, or can people opt out and remain remote for the long haul or permanently, and trying to juggle what's going to work best for everybody and honor safety and trust of all of those people is real important. And Gail, I know you've got something, and then we have one quick question here too.
I was actually going to go to the question. Just
okay, perfect.
I think that that is an important question. We have focused at first very, very much on at-risk communities, communities of color, but we serve Idaho and Utah, which I think have a lower, are very rural and have some lower uptake of the vaccine, especially in Idaho. And some of the things that we're doing is we're working with our employers, right? So we work very closely with the employers, small business, large customers, to help them have some tools that they might need, the information, whether it's vaccine clinics in their own, their place of employment in the future. That's not happening now, but how can we help them help their employees overcome hesitancy? So, there is an effort around Main Street, small business employers. How do you get your employees over that hump and get them vaccinated? So those are some of the types of things that we're leaning into to not only work on those at-risk populations, but also look to the hesitancy that you're seeing in some of the rural communities.
And with that, I'm looking at the clock, and we've got only 2 minutes left before we need to go. And there is a large group that are on this, currently logged in, that'll be joining us on a separate Zoom call at noon. And I wish we could carry on this conversation for much longer. I'm sure that the next hour with this other group of people will be an ongoing conversation. You've been really wonderful. We appreciate your insights, and I see lots of other folks adding to that. Final thoughts, Orest.
Just want to say thank you, and I guess I'll share one more thing. That one of the best moments during the pandemic was last year. About, I think it was halfway or 3/4 of the way through the year, but our operations leader, Lisa Tarantelli, without my knowledge, called, and she and Julie, who works with her, called all 100 of our caregivers on the communication team just to check in to see how they're doing and if they need any small piece of equipment to ease their way as they're working from home. And that's it was awesome to see. And those are the kind of moments that you take with you through all the very difficult stuff that we work through. So thanks for the opportunity to be here today.
Thank you both very, very much.